My name is Pierre, and I am your host. This evening we are discussing raising awareness about prostate and breast cancer, cancers in men. We know that on Friday, the 19th of November, is International Men's Day, and I'm happy that we have GrenChap, we have GPPA, we have Pan American Development Foundation, all part and parcel supporting this particular men's health series. We do have to focus on our men a little bit more as we to ensure that they live healthy lives. Okay, so we are talking about raising awareness about prostate and breast cancers. So let's hit the ball rolling. What exactly is prostate cancer? Dr. Martin.
Thanks. Thanks very much, Arthur. By virtue of definition, prostate cancer is simply cancer of the prostate. In other words, cancers get the name based on where they develop. So if you have a cancer of your fingernail, it's going to be called a fingernail cancer. That's really by virtue of definition. I think what is more important is understanding what makes a cancer happen. And that possibility can happen anywhere in the body. So really and truly, a cancer is a situation where a certain part of the body or a certain cell of the body loses its ability to control its growth. And that cell simply grow out of control. So that really what is a cancer is. So a prostate cancer is a prostate whose cells have lost the ability to control its growth. And so the prostate keeps growing out of control. In the past, I've used an analogy. I used to say, you know, teenage children, you can't control teenage children. So teenage children is a cancer. You just cannot control the growth of this. And really and truly, that's what a cancer is. And by virtue of definition, that's what that situation where the prostate cells simply grow out of control. Over.
Very well. My apologies, but I should have asked persons to introduce themselves. I know that Dr. Martin is well known, but still, permit me, folks, just kindly introduce yourself so that we can just continue the conversation. Thanks, and apologies again.
Dr. Devon Francis.
Welcome, Dr. Francis.
Thank you.
That's it.
Dr. Devon Francis is a district medical officer, a very experienced doctor who has a depth of knowledge in pharmacy and medical public health at the district level. He functions at the south of the island. Devon Francis, you want me to go on?
Thank you. I know he's a very humble individual. Oh.
Thanks, Dr. Martin. Thank you very much.
A few words, but he has some serious depth. Very well, very well. I think we do have the author Hosten. So I'll ask him to introduce himself.
Wow. Well, I think for those who may not know me, I'm a cancer survivor, 24 years cancer survivor. I was diagnosed with Hosten lymphoma, and I journeyed through the United States back in 1997 and did a series of treatments. And here am I today at a testament of perseverance.
Very well. Thank you very much. And of course, I'm excited to hear of your story as we continue this discussion this evening. So thank you so very much. So that's it for our introductions. Well, I'm Pierre, as I said before, and I'm your host. men's advocate. I like to term myself that. Okay, so we were talking and talking with Dr. Martin. Dr. Martin was speaking a while ago, and he was explaining to us exactly what cancers are. I want to go a little bit further in the issue of prostate cancer to talk about the symptoms. What exactly are the symptoms of prostate cancer? And how can we really actually identify that? I would ask Dr. Francis Devon Francis to assist us in that regard.
Okay, in terms of symptoms of prostate cancer, one of the major thing I want us to, that most prostate cancer can be what you call asymptomatic or don't have any signs, warning signs. Yeah, generally you would find that the warning signs of prostate cancer may start at a more advanced stage, and I want us to take very key note of that. So early in the disease, you may not find any signs and symptoms, but in general, what you may find, what you call urinary hesitancy. In other words, I go to pass the urine and the urine not coming. I have to wait for the urine to come. You may also find what is called dribbling, right? I now have to go over the toilet bowl so that the urine can drop in the toilet. I'm not shooting for the roof again, right? So you may have dribbling, you might have urinary incontinence, you might have burning and urination. You can also have blood in the urine or the semen. You may have patients that may have painful ejaculations, or you might have ongoing back pain in the groin region, right? These are all signs and symptoms that you may find, or you might find distension of the bladder. That is also a sign of, that can also be associated with prostate cancer.
Explain distension of the bladder, please.
Right. Distension of the bladder comes about because of what you call, in other words, your inability to pass the urine. Right? Because the prostate or the gland might block up the exit path from the neck of the bladder. As a result, you have backing up of the urine. Right?
Okay.
And that can cause some discomfort there.
Okay. All right. So my thing is, now, if a gentleman begins to see all of that, what should he do?
Right.
Two of those symptoms, he's seeing that. What should be his next step?
Right. His next step should be to see his physician, because you need to know as to what the exact cause of those symptoms that we mentioned, right? By what the doctor can do is to determine the exact cause of those symptoms that we talked about, which may not always be linked to prostate cancer itself, right? So the determination of that is important. And there are a number of modalities available in terms of screening and so that can be done, right? We have the examination that can be performed, or you can have a PSA, which is a prostate specific antigen that can be done. You also have imaging studies that can be done, and based on what you find, you can finally do what you call a biopsy, where you take a piece of the tissue and determine exactly what is happening with the patient.
Now, whenever men hear about prostate cancer, all they see is the digit inserted to find out exactly what's happening. You just outlined all the different other ways that it can be identified. Yet for all, we are seeing some numbers in prostate cancer. I can remember some time ago, Dr. Martin did a presentation, and they were talking about cancer, and he showed the amount of men that seem to have come down and even actually died because of prostate cancer. Why are so many men dying because of prostate cancer? And it is something that persons some persons could live long with. So I really need to know exactly why are so many of our men folk becoming victim and dying because of prostate cancer.
Right. There are multiple reasons why that might happen. One, we have to look at the culture that we live in. Yeah, there is a cultural notion that you alluded to, the digital. Yeah. Also, men generally don't show up very early, meaning that they are not very diligent with seeking medical attention when there is a problem. Unless it really gets out of hand where they really, they can't deal with it any further. Generally, that's when you see they start appearing, right? But there are a number of important factors that consider, right? In terms of risk factors for prostate cancer, and having that knowledge is definitely going to put us in a better place where we are more aware of what needs to happen in terms of screening and so.
Mm-hmm.
Also, we may find that men, in terms of there is a close relation, or there is a debate going on, I should say, with prostate cancer and diet, right? It's alluded that diet is one of the predisposing factors. Also, alcohol consumption is a predisposing factor.
Very interesting.
Right. And from some of the studies that I came across, it's been shown that beers can make cancers more aggressive, right? Beers can make some of can what you call precipitate the aggravation of some of the cancers.
Wow.
Right.
Wow.
And in our society in Grenada, we have quite an awareness as to one of the studies that came out not too long ago with the alcohol consumption.
Yep.
In our country.
Yeah.
So we're quite familiar with that. Right. So we talk about the diet, which is important, and we also talk about other cultural practices. But most important, I would say that men are not very diligent in terms of knowing the risk factors or visiting their physicians as often as they should.
Okay. I want to invite Dr. Martin to just share his perspective on the same question. Why are so many men dying from prostate cancer? And what are some of these risk factors? When I hear about beer drinking and alcohol consumption, Grenada is well known for high levels of consumption of alcohol, right? And sometimes at a very early age, we find young men consuming. They may not consume hard liquor, but certainly we find them consuming beers. Dr. Martin.
Well, thanks, Dr. Francis, for that deliberation on this. So here is what I did. I looked across the world from the east right up to the west, from the eastern area, the Asian area, right up to the United States area. And what I found by looking at the deaths from prostate cancer from west to east is that there is a continuous increase in the amount of prostate cancer diagnosed across the world, from east to the west. We find that in the Asian countries, the chances of death from prostate cancer itself is the lowest. And when you get extreme west, which is the United States, the chances of prostate cancer being found was the highest. Wow. However, the death rate related to prostate cancer showed an interesting figure. What it showed is that the chances of getting prostate cancer increased as you go from east to west, but the chance of death from the prostate cancer was the opposite way around. Wow. Whereby in the United States, you're most likely to be diagnosed with prostate cancer, but you're less likely to die from prostate cancer. So there is a few things that you have to think about here. What has changed as one moves from the east to the west? And the most important thing that we have seen that change is diet. So it turns out that a Western diet seems to be associated with the increased chance of prostate cancer. However, the death associated with the cancer was lowest in the United States. And what does that say to you? That the deaths may have something to do with the health system that the country has at that point in time. In other words, the United States can diagnose you early, but they can save you earlier. Now, question is, where does Grenada lie? Now, Grenada is not in that data that I've collected. So what I did was, I looked to a country that has a demographic close to Grenada. And I said, okay, maybe that's what we can do. So the countries close to Grenada was actually Zimbabwe. Zimbabwe's data was there. And I chose Zimbabwe because Zimbabwe, we in the Caribbean here are displaced Africans, if you want to put it that way.
Yes.
You know, like I say, if a pig was born on a cow pen, you don't call the pig a cow just because he was born on a cow pen, right?
That's correct.
So,
Go ahead.
so we as Black people was born in the Caribbean, but I mean, we are from Africa.
Yes, yes.
So what I found was that in Zimbabwe, the rate of prostate cancer was extremely high. You could say it was lower than America because, of course, the population and so on. You know, it was lower. But the death rate from prostate cancer in Zimbabwe was almost 90-something%.
Wow.
And so what it says to you is that it's somehow in the Black population, there is something that is more. Yes, I know there's a cultural issue. There's a health issue, but there is something to speak about what happens in the mind of a Black man that causes him to die from prostate cancer. Dr. Francis alluded to it because he's seeing a lot of it in the community. Yes, there is a diet related, but I think, to my mind, if you're going to ask me, the most why I think men die from prostate cancer in Grenada is a psychosocial reason that was built in us as kids, that men are we're how do I invincible. Right. It's a psychological component that tells a boy that you're not supposed to cry because you have to be tough. A psychological component that says, as a teenager, you can't be soft because no girl will like you as a teenager. And as a young man, you have to be strong and show people that's hegemony as a man. You have to drink a lot of alcohol, and the more alcohol you drink is better for you. You know, men beat their chest Monday morning and say, listen, man, I beat it last night. And they think that is supposed to be something really, really good. So I think society, if you want to ask me, society is responsible for men dying so much from prostate cancer. Wow. Yes, I know that could be argumentative. And I know Dr. Francis has all his clinical and issues there, but I believe society and the public health approach to men's health is what is responsible for men dying from prostate cancer that much.
Wow. Wow. Well, both from yourself and Dr. Francis, an eye-opener for me. Trust me, it's a serious eye-opener for me. Wow. Just before I ask Brother Hosten to come in, I want to find out, at what stage should men begin to check their prostate for maybe issues of onset of prostate cancer? What age? At what stage in their life?
Okay, so there are many different factors that will determine at what stage one should check for prostate cancer. And I want us to be very mindful that in saying that, we referring to screening which information, the PSA or the imaging studies that we refer to. Mm-hmm. They are what you call different levels of risk factors. So the person that have what we call average risk factor, right? And when we say average risk factor, we talk about age and so. Should start screening around the age of 50.
Okay.
Right? Then we have what you call a higher level, a higher risk factor. That's where you have a first degree relative that have prostate cancer, a brother or a father with prostate cancer. Or if you Afro-American as Dr. or Afro-Caribbean, as we may say, as Dr. Martin alluded to. So that is very crucial. I'm going to repeat that. I'm saying that if you have a first degree relative that has prostate cancer and died or diagnosed before the age of 65, at the age of 45, right? Now, if you have more than one first degree relative that was diagnosed before the age of 65, you should start screening at the age of 40.
Wow.
Right? And that is important. That is very important, because these are the things that would create some answers to the question that you asked earlier. If we are aware of those family history and those information, then we're in a position to make better decisions.
Right.
Right.
Okay. Thank you so much. So we could safely say that from around the age 40, as soon as you're getting into your 40s, you know, we need to do some medical checks. Brother Hosten, you are a cancer survivor. And I'm happy that you are on board with us tonight. You can unmute your mic. I'm happy that you are on board with us, and you have come forward to just enlighten us with cancer. So talk to us. How has it been? When did you discover? What were your feelings like? How has the experience been?
As the one doctor said, men do not go to doctors. And at the time, in my 30s, young and mature, DG at the time, popular DG on the West Coast, very mature. And going to see a doctor wasn't part of my, wasn't on my agenda at all. So when I first had been signed, the clear signs of cancer, and in particular Hodgkin's, the swollen glands, the night sweats, the itching, the pain after consuming alcohol, I found a reason for it. I made excuses why I had a swelling on my leg, why things are happening to me. But the idea of going to a doctor never crossed my mind. And before that, going to a doctor was never part of my agenda. Now I see a doctor before my finger hurt me. But in those days, no, it took me a good year with symptoms before I seen a doctor. And I was advised to go and come back in 2 weeks, and I felt better. I didn't return until the that I had to rush, get a friend to drive me this time down to St. George, living in Grove at the time, to see a doctor who said to me, let's do some surgery and do a biopsy. And from there, the news came like a freight train, or came like a Ivan King, barreling down with the news of cancer. But the good thing is that I'm a pragmatic person. And even today I was telling some people we were talking and said that the leading cause of death is life. So when I was diagnosed, I never for a second I thought there is death down the line, but I have to die anyhow. So let me deal. My insight going to cancer treatment was, let me deal with it. Right. So when I asked my doctor, Dr. Dominguez at the time, what are my options? He said to me, if you treat me in Grenada, but he would prefer I go overseas. So I said, okay, in my family, I'm the only one in Grenada, and it's difficult for them making trips to come and see me, so I go to them instead. And then that trip to New York and 8 months of radiation, I'm here today. But it tells you that early intervention, early check with a doctor could alleviate a lot of things. And it's a multiple financial burden would have eased the stress on the family, because a person diagnosed with cancer and is treated for cancer, any kind of cancer, it is not only the person, not only the patient. It takes a toll on the family. It takes a toll on your close friends. Somebody has to look after you. Somebody may have to prepare a meal for you. Somebody may have to drive you to the hospital. I think they may have to forego a day's work or hours of work for you. So it affects not only you, and you cannot be selfish in saying that, okay, I'm not going to say that, but because when you make that selfish decision, it affects your family, your wife, your husband, your children. It affects people around you that love and care about you.
Wow. No, you made some very, very serious points there. The issue of how it affects your family. What was your feeling when you got the news? How did you feel? Your mic seemed to have gone a little bit. Right.
It was a reflection. Then the doctor said to me, my brother, we did the biopsy and the result came back, it's cancer. I said, holy shit.
Yeah.
And that was the only reaction. And I didn't say anything. And he was speaking to me. I didn't hear a word he was saying to me until I came back into my body.
Yeah.
I think I left out of my experience. And he touched me on my shoulder. He said, are you with me? I said, I'm with you. And then I started to hear what he was saying, because the news was heavy.
Yeah.
And I was just lost of words. I just couldn't say anything.
Right.
And I drove silently from Grenada to my workplace on the Carolinas. Not a word with my driver. I couldn't tell him, I had to tell him something. But it was for me to be strong, not to break down.
Right.
To be trying to be a man in mature thing. But along the journey, it became more frightening. And when I told him, I think it was somewhere in Belmont, and I said to the doctor, that I have cancer. But he nearly killed me for the bones. He nearly and we got to my workplace, and then I was walking with a crutch because they did surgery to remove the lymph node. And then time I get inside the office, I was looking at personal surgeries in Burns Point at the time. And he was already crying, so they knew something was wrong, and everyone is like, so it was getting the news was really bad. Really bad.
I mean, I know that when I was growing up, when persons in your community or your persons would have come down with cancer, it was almost like a death sentence for individuals. Persons were so afraid of it, almost the same kind of fear that we might have been seeing for HIV and AIDS. Right? So persons were actually afraid, and some persons would not even say that they had cancer. So I mean, I really commend you for coming forward and be willing to share your experience and your story as we discuss the issue of cancer. so we spoke about the age that we need to screen, but there's a question, both doctors, I want to talk about. From my experience with HIV and AIDS and sexually transmitted infections, we hear about HPV, and I want to ask both doctors to chime in on this. Does HPV, can it contribute? Is it one of the factors that may contribute to prostate cancer? Dr. Francis, Dr. Martin. Anybody there?
Sorry, I had a technical difficulty. Somehow this thing was just...
The technology eluding you, man.
Yeah, I'm telling you, but I hope it is resolved now. You're able to see me, yes?
Yes, I'm seeing you and I'm hearing you.
Okay, great. Now, the thing is, traditionally, HPV has gone through a period where we had to take it from where we knew it was to where we have to have it now. Now, HPV was a virus that was not spoken about very much in the past. As a matter of fact, more than 2 decades ago, one of the gynecologists, I think it was Dr. Joseph, she used to start saying that unless we start viewing HPV as a sexually transmitted disease, we're not going to get to the back of this issue of cervical cancers, because HPV was the main cause of cervical cancers. Well, fast forward 2 decades, we have now considered HPV to be a sexually transmitted disease causing cervical cancer. And this has done so well that we now have a vaccine for HPV, because we recognize that HPV can cause serious cancers like cervical cancers. The truth is, many researchers have found that HPV was more common in prostate cancers than in normal people. So I think because of this realization that many people with prostate cancer seems to have a lot of HPV in them as well, I think the bulk of evidence is beginning to put together that HPV may contribute to prostate cancer. But I will tell you for sure, when I was in medical school, that was not the school of thought. All right, HPV was not really a huge part of what's going on. But now I think more and more the data is coming together that it may be, because HPV causes changes at the cellular level on the cervix of the woman. And so there is reasons to believe that HPV can also cause changes at the cellular level of the prostate. In Grenada, what is very clear is that HPV causes cancer of the penis. I personally have had a patient, 1 or 2 patients who have had cancer of the penis caused by HPV. 2 weeks ago, I biopsied a lesion on the penis of another man. I didn't tell him, but clinically that thing is cancer. I'm just waiting for the results to come back in. And he's had this HPV, which is like a warty issue there for some years. So I think among men, we need to raise the conversation about HPV so that we encourage our boys to get the vaccine, which is one thing. The vaccine can be taken up to age 26, or young men can take the vaccine. Men can practice more judicial sexual activities and behaviors, because HPV is a sexually transmitted disease. And while we know HPV can cause the established cancers of the cervix and the penis, we now need to raise the conversation in men that there may also be an association between prostate cancer and HPV, which is the human papillomavirus. Over.
Yeah, very interesting. Very, very, very interesting. Very interesting. Now, Doc, there's a question I want to ask. And I don't know, I hope that Dr. Francis could chime in on it as well. We have a lot of cancers, and we know that sometimes HPV could be, just as you outlined, might be one of the factors. We're talking about oral sex. can that contribute to things like throat cancers as well?
Well, that's interesting because there's loads of research that looked into that issue. I remember probably about 10 years ago when I started to look into this issue of cancers, and I looked at the papers, and I saw that there was an increase in the amount of throat cancers in actually young people. Wasn't actually elderly folks or men who normally get prostate cancer. It was actually throat cancers in the younger population. Those studies were actually done in Europe and the United States. And what they found was that there was an incidence or an increased number of throat cancers in young people. And when I asked the guys who I was presenting to, when I said to them, we have found that there is an increased chance of throat cancers in young men. What do you think the cause of it was? Well, I'm telling you, Arthur, you would know the bulk of the answers in the population, especially answers given by women. The answers were, yes, they're smoking too much and they're drinking too much alcohol. And everybody was convinced that it was alcohol and smoking, especially the women, to think they know more than men. Women who think they know more about men than men themselves. But that's another argument.
Careful, Doc. Careful, Doc. Go ahead.
Anyhow, I digress. But anyhow,
yeah.
what the papers was showing is that many of those young men who developed throat cancer was actually because of HPV, human papillomavirus. And it was two of those serotypes that was mostly common. Some research out of Israel, however, brought some light to the situation, because what they found was that the lycopene that is found in pink foods, especially tomatoes, was actually protective against the throat cancers in young men. And the lycopene is present in pink foods. So things like pink grapefruit, tomatoes, pomegranates, pink cashew nuts. Those were the important things. So yes, there is an increase in throat cancers in young people because of HPV. So what I've been telling people, because I know people practice sexual gymnastics and all kinds of things. And so oral sex is a main thing that a lot of young people are involved in, young men are involved in, and some ladies actually require it. And so I wouldn't get to say to the guys, those of them who are interested in oral sex, take a tomato and put it on the bed head. So as soon as you do your issue, you just take your tomato.
Wow, that's some serious advice, Doc. Dr. Francis, I don't know if you want to step in on this and make any comments as it relates to that.
Well, basically, Dr. Martin would have encompassed most of the researches and so on. They provide most of the information. As he said, there's definitely a link with throat cancer and oral sex, right? One of the things that we would want to be very, we want to be careful of as we talk about men's health is our attitude towards those vices. Generally you find that there would be increased incidences, and so when we stray from the norms of society and men, I want to roll a little bit back from Mr. Arthur Hosten's comment.
Right.
I can't let that pass without just emphasizing that men are the makers of the society in a lot of ways. From a spiritual point of view.
Right.
And we would have looked at societies where there would have been degradation in the family as a result of the absence of men. I've seen societies where you lock up the men and the family, the young ones go astray, the family is destroyed. So we understand the significance. Those societies understand the role that men play in the family. And that economic and emotional aspect is very, very overwhelming, losing a breadwinner to a family, the impact it can have on the family. You know, as men, we cannot allow, you know, a simple examination or a visit to the doctor to prevent you from seeing your sons and daughters graduate or your grandchildren from graduating.
Yes, yes, very important point.
You know, and I want to emphasize a bit on the self. The I don't like, and I don't like this, and I don't like that. Recognizing that we are part of a bigger entity. The family is a bigger entity than I. You know, and we have to come forward. We have to step up. We have to step up to the plate and say, okay, well, I'm the head of that home. I'm going to take that visit for my family. I'm going to take that visit to see my children graduate and go to school and turn out into what they dream of. I'm going to, you know, foster that dream. And we cannot no longer take that approach of the I don't like this, and I don't like doctors, I don't like rectal, and I don't like, you know, all those sort of things. I think that we got to refocus of men in the family is.
Yes, yes, yes.
Yeah. That's the point that I really want to chime in on.
Very good, very good. Wow, that's some deep stuff there. But that is so very true. I mean, sometimes as men, we just focus. We don't believe that we are needed. We don't realize how important our presence is in the family, and because of that, we figure out. I don't really care. I don't. You know, what would happen would happen. And I think Brother Hosten talked about that a little while ago. Very good. I want to also just raise another issue. And this one is kind of close to me because I had a mother that died from breast cancer. So the question is, can men develop breast cancer? Any of the doctors, you can chime in.
Well, Arthur, I'll take the liberty of answering that, and I will let Dr. Francis speak about what he is seeing out there in the community. And I'm taking the liberty because I have had the unpleasant opportunity of diagnosing a man with breast cancer. Over the years of practicing medicines, I've got a few little skills that I keep using, and one of them is biopsies. In my private practice, a man showed up with a lump in his breast. And by the way, lumps in breast of the male figure is something that we need to understand. We also need to encourage our young mothers that when you see a lump in the breast of your boy who is between 9 and 14 years old, please don't take him to the doctor and say you have a lump in the breast. That lump is because he's changing and becoming into puberty. And that again underscores how much we don't know and how much we don't put on our boys and our men. So, and I once I said in a public forum, that was the easiest $70 I ever made, because this young mother bring her child to the doctor.
Yes, because a lump in the breast.
A lump in the breast, and the child was just going through puberty. But then, of course, the other aspect is true where a man in his mid-40s, in the middle age, came to me because he had a lump in his breast. And I do lumpectomies in my office. I do take off those lumps. And when I took off the lump, I thought it may have been a cyst or some kind of thing that he had. And I was, well, not amazed or surprised to see that it actually came back as breast cancer. I mean, the good thing about it is that he was careful enough to locate the lump early. And I was lucky to have taken off the entire lump so that when the result came back, it showed that the edges of the biopsy I took was free of the cancer, so that we were certain that he took all the cancers off. And of course, he went to the States for further care. But that underscores the fact that it is possible. Men can get breast cancers, and we need to also raise that awareness among the male population that we do have breasts and we are at risk of breast cancers as well.
Okay, excellent. Dr. Francis, I don't know if you want to chime in on the same thing.
Yes, just to, in terms of what you call predisposing factors, very significantly, we have things like age, family history plays a very important role in breast cancer, and that family history could be what you call mutated genes, gene that can be present in both male and female. Okay, and that is important. That's one of the more predisposing factor for breast cancer in men, which is the family gene mutation. Okay, in fact, it says that it increases your chances of developing breast cancer by 6%, whereas in the ordinary population, there is just a mere less than 1% chance of you coming down with breast cancer without that mutated gene. Okay, we also have other predisposing factors like liver cancer. We have testicular disease and so on, surgeries that have been performed. Alcohol is also linked to liver disease, as we know, and liver disease is also a predisposing factor for breast cancer, right? Importantly, they talk about age as being a predisposing factor also. In other words, the incidences of breast cancer increases with age. Okay, it's recommended that you do breast cancer screening between the age of 60 and 70, right? And that would go up if you have what you call a genetic disorder where you have a mutated gene. They make the recommendation that you should do yearly screening, that also involve mastectomy and ultrasound and a breast examination. So I just want to emphasize the importance of the family history. Is one of the more important predisposing factor, right? Quite interestingly, I also found that same mutated gene is also linked to prostate cancer. There is correlation between that mutated gene that can cause breast cancer and prostate cancer, right? So the family history do play an important part in terms of your awareness. Okay, if you have family members that have breast cancer, whether we say that the gene can be both in male and female. So it sort of should create that sense of awareness that if I have a family member that have breast cancer, then I should, and depends. It's more important if the family member would have had that breast cancer at an early age, right? And when we talk about the early age before the age of 50,
right,
it more raise the suspicion of a possible gene mutation and should further lead to further studies. There are other places where they do screening for that particular gene mutation, which is not available locally to us, and that as to how often we would recommend breast cancer screening for our male population and so.
Okay, thank you so very much. Now we have looked at what cancers are, what are some of the symptoms, what are some of the causes, various factors that may contribute to the development of cancer. And I want to turn to Brother Hosten. Treatment. You said in your introduction that you would have traveled abroad and you would have undergo treatment for cancer. What was that experience like, and what sort of treatment did you take? You can unmute your mic. I think your mic is muted.
Okay, sorry. Okay. Yeah, like I said, after being diagnosed and told that I have to go for treatment, I made all arrangements and I went to New York. And when I got there, I had a choice of what they said to me. They could do chemo and radiation or both, either one or both, based on what, when they could stage me, when they do over all it, I had to send for my family and then they go over the entire process, the proper staging, which, as the doctor said to me, everything was done correctly, but he was doing his own thing to know what he was looking for. But he did confess that in Grenada, when they had sent for him, everything was correct.
Okay.
However, we opt for one of my family doctors told me if I should do only radiation. And he had a discussion with my radiation oncologist, and they had agreed that that is the route that we should go. So we started that radiation, and I was diagnosed with stage 4. So I had the diaphragm above the diaphragm.
Wow.
But when we did the first 6 weeks, we did a lot of chest x-rays and later on a gallium scan. And that's when they found extra nodes all around him, all in the neck, because they wasn't seeing that before. But halfway through the treatment, they found the other nodes. And we were able to expand the treatment. It was a daily trip. I wasn't hospitalized. It meant that I drove from Manhattan to Brooklyn, where I chose to do it at downstate, and I live in Manhattan. So I had to make the trip every day, Monday to Friday. And it took a toll emotionally for my sister, who was the one driving me. And I looked at her, and I made a point earlier on that when you're doing treatment, it's not only you, but the family is involved. So I made a conscious decision along the line that I'll take the train, and she didn't want that. So I said, no, I'll take the train and go down, because at that time I get to know the place.
Right.
And the train was 1 minute from the hospital. So I started making the trip, but when the radiation became so intense that all the capillaries in my neck was exposed, and there was a scent, a burning scent emanating from me. It became embarrassing to be in public. I was smelling it. I wasn't sure if people were smelling it. So I started staying home and then started being driven to the hospital because people were staring at me. I carried a scar where there's no growth of hair in the back of my head to this day. But people were staring at the deformity of the back of my head from the radiation, the exposed neck. At one time I had a big 7 on the front, on the tongue, and at the back from the radiation. And so I used to wake up in the morning, take my shit from the bed, red shit, and throw up that skin because the radiation was that bad. But I had to be strong because they were looking at me, my family, my siblings was looking at me, and we all gathered every night. I'm the only one of my siblings in Grenada. The other 5 was in New York. And so everybody came together in the night at home. So I had to be the strongest. I could not show any weakness because I know they would have go home more depressed than I am. So in my quiet moment, the questions came in to step up. And once somebody was around, I was the bravest man in the room.
Once your mother was around you?
No, my mother was already died. She would have died as a baby. I'm the baby in the family.
Okay.
Because I'm the youngest, and everybody know I'm the one to take care of everything.
Right.
Problem solved. There was no reason. God had no right to have me sick because then I'm sick. So it was panic from everyone that I was a sick one because I was happy-go-lucky one. I was the one in every party activity. I am there. The life of the party, the stricken, and I didn't want them when they sit down in our living room to be the one moping. I was the one preparing drinks in the kitchen, cooking food, and putting on a show. Because I am depressed, the body is depressed. And it comes back to one cannot be selfish.
Yes,
That's
yes. Yes. But that sorry, go ahead.
Well, the treatment, it was divided into it should have been one steady treatment, but when they found it above the diaphragm, we had to go back and do other blocks because they put blocks in different parts to shield the heart, the liver, the vital organs that won't be damaged.
Right.
But in his 1997 linear accelerated treatment was a new thing then. Before that, it was whole bar system of radiation. So it was early stage of linear accelerated radiation, and it took a lot of weeks and days of mapping the body.
Yeah.
And a lot of adjustment to go along because when the burning became too intense, they had to reduce and stretch it along a period in an intense radiation. Like I said, it was early days of that time. They had to leave room for the mistakes. I had a Haitian technician in the room, two Jewish radiation oncologists, and we consulted every Friday of where we are. We looked at all the scans, and I was kept abreast every step of the way because and I made sure I was doing a diary, so I wanted to know where I am, what progress we were making. So we were having consultation every Friday morning. Once I finish treatment, we go into that room and log down at question time.
I must say, sorry, go ahead.
Another thing we do here, one, we don't go to the doctor, but when we do go, we are so frightened of the doctor. So we don't write down anything. We know what we're going for, but we don't write it down. And when we get there, we forget other two things that we came for. Remember one. And there are three things we came for. The other two will go out because there are still some with respect, but also fright. Then fright of going to the doctor. The nervousness was kicking. And you will forget. So it's always good to write down everything. When I'm tonight, I decide I'm going to see my doctor tomorrow, which I do almost every 3 months. I see my doctor. And I'm in Cuba most times. So see my doctor is an easy thing for me, and it's a lot cheaper for me.
Right.
Comes up week, I do my CDCs, and that is an easy thing for me to do now. Giving my hand to a doctor for an injection or to pull blood is an easy thing for me based on my experience, and I want it to be done. For this year, I've seen doctors in Grenada 4 times. And one doctor said to me, it's for minor things. But I didn't mind. I didn't take any chance. And I said to him, based on my diagnosis years gone by, anything hurts me now, I'm in front of doctors. So
I must say, Mr. Hosten, that I am impressed with your bravery, the selflessness, based on the fact that you said that, look, you did this not just for you, but you did it for your family. So
one son. At the time I had one son.
One son.
And we still one. It's still one. I didn't.
Okay.
I didn't. And that was one of my factors coming back with my cancer could not have taken me because I had a 10-year-old son.
You had somebody depending on you. One son depending on you. Very well. Wow, that takes some serious internal strength and some serious introspection to reach at that kind of point, that level, to be able to really pull through some very, very trying and difficult moments. Thank you so very much.
But to have my nephew battling colon cancer at the same time, like I was battling infection. He passed away 2 weeks after I was diagnosed and said, go home. He died 2 weeks after.
Yes. Wow, wow, wow. Okay. Okay. Let me just turn to doctors. Treatment. Talk about, you have heard Mr. Hosten talk about radiation. And I know that there's chemo. Very briefly, because we just have a few more minutes. I mean, time go by so quickly, and when you are actually getting into the meat of the matter. Treatment, Dr. Francis and Dr. Martin.
Okay. In terms of treatment, I want to say that treatment is very optional. Okay. It's a discussion that needs to be held with the patient and the managing physician. And treatment can vary based on a number of factors. One, we got to look at the stage of the cancer and the type of cancer that we're dealing with.
Mm-hmm.
Okay, there are different types of prostate cancer in that you have what you have 99% of prostate cancer, as a matter of fact, are of the type you call adenocarcinoma, which is a very slow, benign type of cancer.
Mm-hmm. Mm-hmm.
Okay, and you have the aggressive type. So depending on the type of cancer that you have, it will also influence in your management. Also, the stage at which the cancer was diagnosed, right? If the cancer is confined to the prostate, right, like stage 1, stage 2, where it's still in the prostate gland, generally the approach is surgical removal, generally, depending on the type of cancer, as we said again.
Right.
Okay. It also depends on the health condition of the patient.
Right.
Because, and importantly, they also mention about the life expectancy of the patient. If you have a life expectancy of less than 10 years, right, they generally would take the conservative approach, right? In terms of not wanting to do surgery and all of that.
Mm-hmm.
So there are a lot of factors that will come into determine which method of treatment is preferred, right? So there is no right and wrong treatment. It all depends on the multiple of factors that we talk about, right? And we have what we have available. We have surgery where you can have radical prostatectomy, or you can remove the prostate, the part that that has the cancer.
Mm-hmm.
That is available. We also have the radiotherapy. We also have radiation, right? That you can use different types of radiation. There's also chemotherapy that Mr. Hosten would have alluded to. And there are other modalities of treatment where you can freeze the prostate itself, the cancer, and so, right? But overall, I would say the type of treatment would be determined by the patient, best determined by the patient and the physician, in light of what stage the cancer is detected, the type of cancer. There are cancer that you can monitor for the rest of the patient's life. In other words, they are not the aggressive type, they are slow growing,
Mm-hmm.
right? And they don't need anything else than just maybe a PSA every year or every 2 years, depending on what the situation is.
Okay.
Yep.
Thank you. Dr. Martin, and when we talk about treatment, we also want to talk about the economic factors briefly.
Right. In addition, the islands of the Eastern Caribbean has signed an agreement with the Cancer Center that is of the Eastern Caribbean, which is based in Canada. In Antigua, my bad. And if someone has prostate cancer, for a capped fee, I think the capped fee is about 10,000 US, 10,000 EC. They can give you whatever treatment you want for prostate cancer at that center at a capped fee. But that person has to have been referred to the Cancer Center by the Ministry of Health of the Eastern Caribbean. Mm-hmm. And that place is in Antigua. Gone are the days when people take off cancers. We don't remove cancers anymore. There are so many options now that they don't remove cancer anymore. And one can argue, don't get me wrong, one can argue that the reason the surgical services for prostate cancer has moved away from removing the cancer is because the service providers are finding ways to continue to make money out of these things. In other words, if there's a prostate cancer and you remove the prostate cancer, then that person is healed and that's it. In fact, I have many patients who have had brachytherapy or therapies that remove the cancers or kill the cancers from inside, and it's a one-off treatment, so they don't have to go back to doctors anymore. Similarly, removing the prostate means that you don't have to go back to the doctor because you do have a full recovery. So there is one camp that is saying that the reason the world of prostate services have moved away from removing cancers to treating cancers is because they want to have a continuous economic base for treating cancers. That's one argument. And I'm saying I am just a public health specialist, so I have to see it from a public health standpoint. Don't get me wrong, I'm not bashing anybody or anything. But just so you know, that center in Antigua has been set up so that patients can actually go there and remove and get the kind of chemotherapy or radiotherapy, as Dr. Francis has been referring to. In fact, I have a patient who about 3 weeks ago has just returned from Antigua, and he is getting his chemotherapy through our local service provider here. So I just wanted to add that to the argument and to the discussion at the moment. Over.
Very well. We have to wrap up here, but I would love to continue this conversation at a different time because there are so many other questions I need to ask. And again, this is kind of close to the heart because my mother died from cancer. All right, she had breast cancer and died at a ripe old age of 82. Okay. But let me just say that it was a great night. But I just want to get some final words. Let me ask Brother Hosten to any final words, any advice for our young people or young men specifically as it relates to the issues of cancer. Very briefly. Brother Hosten.
Okay, I would encourage everybody, every young man, every household, to encourage the young men to seek medical care and medical checkup early. You don't have to be sick. Make it a routine. Put it with your birthday. So you pay your driver's license. Tighten with a medical check with your doctor yearly. I do it many times, but some people do it once a year. You could do it once a year. Know your status in terms of where your health is at the moment. Is important for you and your family. Get checked.
Thank you so much, sir. And again, I'm impressed, really, really impressed, and really, really grateful for your presence here tonight, for you, sharing your life story as a cancer survivor. So thank you so very much for just being here and sharing it. I really hope that a lot of other persons, young men younger than yourself, around your age, would really listen and take a page from your experience and from you. Thank you so very much, sir. You certainly have impressed me tonight. Thank you so very much. Final words, Dr. Martin, Dr. Francis.
My final words is this, that this discussion tonight should begin a ground raising or a national discussion that must happen on men's health. I have seen the writing on the wall for men's health for more than a decade now. I have raised this issue of men's health at the Pan American Health Organizations for many years. I have tried to get it on the agenda of countries on the Eastern Caribbean. The first year I tried, it was shut down. The second year it was shut down, but then afterwards, it was beginning to recognize. What is certain is that the issue of men's health must be a national discussion in order for our regional public health institutions to take it up on board, which actually means that grassroots organizations like what is happening now has to take up the mantle of men's health. And if you do this, and a number of grassroots organizations take these issues up, then the politicians have to listen. And when they listen, then the regional institutions are going to listen and make men's health a priority. Let me tell you guys, let's be sure about this. The only reason why maternal and child health has done so well across the world is because the issue of maternal and child health made its way right up to the World Health Organization. And that's why maternal and child health is doing so well in the Caribbean. There has never been another force for men's health as there has been for maternal and child health. So this situation tonight and this discussion tonight, though simple it is the kind of discussion that must happen every minute, every year, every month, whatever it is, so that the issue of men's health becomes a priority. It becomes a national priority before it becomes a regional priority. And even then, and only after then, we'll be able to have the adequate resources for men's health, because in truth and in fact, men are actually vulnerable in this iteration. Over.
Yes, thank you. Thank you so much. Thank you so much, Doc. Indeed, men's health must be a serious agenda going forward, because based on what Brother Hosten indicated, is that our health do affect our families and certainly affect our communities and societies. All right. So thank you very much for your words and certainly for all the information that you would have shared with us this evening. Dr. Francis.
Right. Basically, my appeal is that men step up and take your rightful role in society. You are the leader. You are in the forefront. You have a lot of people depending on you. And let's not focus on the I, but rather than the role that you were meant to play in the family. Yes, so I recommend, I would want to emphasize that it's in time that we step up and, have a more holistic family, have a more holistic community and a healthier family. And that approach is not only for prostate cancer, but men's health in general. Mm-hmm. We have to look at all the different, and I find it always amazing that men, we take the vehicle to service every 3 months, but we don't go to see the doctor. We put more priority on things as opposed to that body that we have and our health. And it's time that we recognize what is important and pay attention to what is important.
Okay.
Thank you.
Thank you so very much. Well, tonight we had 3 giants talking about cancer, prostate cancer, breast cancer, cancer generally. We have heard a personal experience from a gentleman, a survivor of cancer, and the principles which he used to ensure that he had strength to go through the experience of being diagnosed and treated for cancer. We have heard from 2 doctors, very experienced, very intelligent, well-researched, and they call for men to pay attention to the health. As we move forward and as we approach November 19, which is tomorrow, we are celebrating, we are recognizing International Men's Day. And indeed, men, you need to pay attention to yourself and to your health. Go get checked. Check out what's going on with you health-wise and do the right thing not for yourself, but for your family, for your community, for your country. Thank you so very much, listeners, and I hope that you have a blessed night. Thank you.
Thank you.